Hello and welcome to my channel. Today we're still in the nervous system and the subject will be the study of the brain. So let's start. Before discussing the brain, we should give a hint about the casing of the brain, which is the skull. The skull, as you can see here, it's a group of 22 bones articulating together. The upper part of the skull is called the calvaria. This is the calvaria and is mostly composed of membranous bones. That is, they are articulating together in joints called fibrous joints called sutures, immobile joints, and membranous means that the bones develop in membranes, so the bone cannot be replaced by bone. That's why in brain surgeries, the defect produced in the skull is covered by prosthesis for life. This is for life. Instead of building bone at the site of the defect, there will be a membrane developed. The base of skull, this is the base of skull. The bones are cartilaginous bones. This means that they develop in cartilage. Although the fact that they are, if fractured, they're replaced by bone, but base fractures are very dangerous to life. Observe that the level of the face is at a lower level than the rest of the skull. In order to give space for the pharynx to be mounted behind the face, see here in this area behind the face opposite the oral cavity. Of course, the mandible is a separate bone, articulates in a condyloid joint with the skull right in front of the ear, and it comprises the lower jaw, while the upper jaw is the maxilla that forms part of the nasal cavity. We have sutures like the coronal suture, the temporal suture, the sphenoid suture, the lambdoid suture or the occipital suture, and of course in the middle there is the sagittal suture. This is norma bisalis inferior, means the base of the skull from the as inferior view. You can see the hard palate here forming the roof of the oral cavity with the two maxillae united in the middle and completed backwards or posterior by the palatine bone. Guarding the nasal cavities, these are the posterior nostrils or nasal cavities with the hamulus. This is the hamulus. And the foramina, different foramina of the skull to allow for the exit of cranial nerves and entry of blood vessels to the brain. Observe the carotid foramen and the carotid canal and the foramen lacerum here. This is the path for the internal carotid artery, showing the fossa for articulation with the mandible to form the temporomandibular joints. And these are the pterygoid plates of the sphenoids, the medial pterygoid plate and the lateral pterygoid plate. Observe the occipital condyles that forms the atlanto-occipital joint, and the foramen magnum, of course, for the passage of the brain stem. Slightly posteriorly, you will find the external occipital protuberance here, the superior nuchal line. This is the superior nuchal line, and this is the inferior nuchal line on the base of the skull. This is the site of the temporum and the infratemporal fossa, and the zygomatic arch allowing for the passage of the tendon of temporalis muscle to be inserted in the coronoid process of the mandible. This is norma basalis interna, or the view from the inside, just to show you the cranial fossae. This is the anterior cranial fossa, formed by the frontal bone, the orbital plate part, which forms the roof of the orbit, and the lesser wing of the sphenoid, which projects backwards into the clinoid processes. These are the anterior clinoid processes. Now, the frontal lobe of the brain lies in the anterior cranial fossa. So the anterior cranial fossa have the frontal lobe of the brain in it. The middle cranial fossa, guarded anterior by the superior orbital fissure between the lesser wing of the sphenoid, and this is the greater wing of the sphenoid. This is the fissure from this side, the fissure, the superior orbital fissure, and foramini rotundum, ovale, and spinosum. For the passage of the rotundum and ovale for the passage of branches of the trigeminal nerve, and here you will find the trigeminal fossa for the trigeminal ganglion. This is the petrous bone, which forms the middle ear, and guarding the lateral side of the, together with the greater wing of the sphenoid, guarding the hypophyseal fossa, or the pituitary fossa that has the pituitary gland in it. And these are the posterior clinoid processes. So between the anterior clinoid processes and posterior clinoid processes, the pituitary gland lies in between in its saddle-shaped fossa. This is the middle cranial fossa, which has the temporal lobe of the brain in it. So the frontal lobe in the anterior cranial fossa and the temporal lobe in the middle cranial fossa. Here the beginning of the posterior cranial fossa, which is slightly at a lower level than the middle and the anterior. You go down from anterior to posterior, the anterior cranial fossa being the highest, then the middle, then the posterior. It's formed mainly by the occipital bone, and this is the clivus part of the occipital bone related to the pons and beginning of and the medulla oblongata of the brainstem. This is the foramen magnum, and here you will find the cross-shaped internal occipital protuberance, site for the confluence of sinuses and the transverse sinuses emerging from it. Of course, you can see the cut section of the skull bone, which are two layers of compact bone with a cancellous bone in between, and lakes of blood among this cancellous bone. It's called lacunae, and the whole structure is called diploid, means double layer. Now, if this is the anterior cranial fossa that has the frontal lobe of the brain, the middle cranial fossa has the temporal lobe of the brain, the posterior cranial fossa has the not the occipital lobe of the brain, but the cerebellum, and do not forget that. So no brain lies here. Here lies the cerebellum. I brought you this picture of the neonatal skull to show you that the bone, before articulating, they have spaces covered by membrane between them called fontanelles. This is an example of sphenoid fontanelle. the frontal fontanelle and occipital fontanelle. We have the mastoid fontanelle. All these fuse together after the growth of the brain to the proper size. Okay, now we come to the brain. In order to study the brain, we must divide it into smaller pieces in able to understand the features of the brain. So we'll start by dividing the brain into two cerebral hemispheres, and each hemisphere, we will work on each hemisphere to divide it into lobes, and then into areas composed mainly of gyri. The brain is the name that includes the cerebrum. This is the cerebrum you're seeing here, the cerebellum, and the brainstem. You can see the convolutions of the gray matter of the surface of the brain. These convolutions called gyri, and between them are called sulci. Okay, so expect areas to be present on gyri, which are gray matter. The sulci, the areas are present at the sides of each sulcus. The sulcus itself actually is a space between two gyri, and the gyri are continuous together in the floor of this sulcus. There are two cerebral hemispheres separated by the interhemispheric fissure, the one you see here, and this fissure has the falx cerebri in it, and in the fissure of the cerebellum has the falx cerebelli. Now, in order to divide each cerebral hemisphere into smaller parts, look for the only continuous sulcus present. I think this one. See? This one. It's rather continuous, and the gyri are continuous below its lower end. It doesn't reach to the on the temporal sulcus on the lateral side. This is called the central sulcus of the brain. It doesn't have to be in the exact center of the brain. It may be deviated posterior in some brains, but it is the one that has complete gyrus in front of it and complete gyrus behind it. Now, in front of the central sulcus, the areas are motor areas, and behind the central sulcus, the areas are sensory areas. Okay, the central sulcus, in front of it are motor areas, and behind it are sensory areas. Now, the first gyrus before the central sulcus is called the precentral gyrus. The first gyrus after the central sulcus is called the postcentral gyrus. Precentral gyrus and postcentral gyrus. The frontal lobe itself, you can divide it into three interrupted gyri: the superior, middle, and inferior frontal gyri. They are interrupted gyri, not continuous. Superior, middle, and inferior frontal gyri. Posteriorly, there is the occipital pole, and this is the frontal pole of the brain. The frontal pole of the brain is much wider and bigger than the posterior pole of the brain, and this is how to know anterior from posterior if there is no cerebellum in the specimen, for example, you encounter in an exam. You don't have to have the cerebellum present to know where is anterior and where is posterior. Function-wise, this is the association sensory area, and at the sides we will see it in a different picture is the temporal lobe, and we can subdivide it as well. In the floor of the interhemispheric fissure, you will find the corpus callosum connecting both sides of the cerebral hemispheres. If you're asked exactly what's present here, it's the falx cerebri with the inferior sagittal sinus in its free border, then the branches of the anterior cerebral artery curving backwards above the corpus callosum, then the corpus callosum. Now, this is the lateral view of the left cerebral hemispheres. See, you can know where is anterior and where is posterior. This is the anterior pole of the brain, which is much bigger than the posterior pole of the brain, or the occipital pole of the brain. And this is the temporal lobe, which always projects anterior. This is how you know your directions when studying the brain. The central sulcus, I can identify one continuous gyrus here and one continuous gyrus here, so this is must be the central sulcus. See, it's deviated posterior, it's not in exact central part of the brain. And this is the pre-central gyrus, the post-central gyrus, and the superior frontal gyrus, the middle frontal gyrus, and the inferior frontal gyrus. Now, the body is represented on the pre-central gyrus and the post-central gyrus upside down. Means the head in this area, either motor supply or sensory supply, and the rest of the body goes upwards until you reach the about the middle of the lower limb, which is on the medial side of the brain. This is the lateral fissure or lateral sulcus, and observe that the central sulcus does not reach the lateral sulcus. It's interrupted here by continuity of both post-central, pre-central, and post-central gyri. Now you can work on the temporal lobe. You can divide it into superior temporal gyrus, middle temporal gyrus, and inferior temporal gyrus. Superior, middle, inferior temporal gyrus. And this is the occipital lobe. You can mark it at, there is a mark to start with. It's called a preoccipital notch. This is the preoccipital notch, demarcates the beginning of the occipital lobe. The upper end will be the upper end of the parieto-occipital, the parieto-occipital fissure, but it's visible mainly on the medial side. So again, this is the frontal lobe, superior, middle, inferior frontal gyri. This is the pre-central central gyrus. This is the post-central gyrus guarding the central sulcus. This is the superior temporal, middle temporal, inferior temporal gyri with the superior and inferior temporal sulci separating them. And the preoccipital notch that demarcates the beginning of the occipital lobe. This is the occipital lobe. You can draw a line between the upper end of the parieto-occipital sulcus and the preoccipital notch. This demarcates the occipital lobe. Now, the area above the superior temporal sulcus is called the angular gyrus, and around the end of the lateral sulcus is called the supra marginal gyrus, and both comprise the inferior parietal lobule. The area above it is called the superior parietal lobule. So the supramarginal gyrus and the angular gyrus are together called the inferior parietal lobule. They are association or sensory areas, and the area above them are the superior parietal lobule of the brain. This is a medial view of the cerebral hemisphere. Again, this is here the end of the central sulcus. It's slightly anterior in this case. This is the frontal lobe with the medial frontal gyrus, all this. The cingulate gyrus. Cingulate means a belt that stretches around the corpus callosum. This is the corpus callosum. You can see the parts of the corpus callosum, which are the rostrum, genu, body, and splenium of the corpus callosum, together with the fornix. This is the fornix below the corpus callosum, coming from the amygdaloid nucleus, or the roof, the floor of the lateral inferior horn of the lateral ventricle in the temporal lobe. It's also a commissure, means that they interconnect together with this fornix with the fornix of the other side. They exchange fibers, the same like the corpus callosum. The fornix and the corpus callosum, they form the upper boundary of the diencephalon. All this area is the diencephalon. Parts of the diencephalon is the thalamus. This is the thalamus. And here the epithalamus, which is the pineal gland, and the habenular commissures between them. The metathalamus comprise the medial and lateral geniculate bodies. They are not showing here. This is the upper end of the midbrain, which is the subthalamus, together with part of the diencephalon, and this area is called the hypothalamus, which is connected by a pituitary stalk to the pituitary gland. This is the pituitary gland, and this is the optic chiasma, where the optic nerves exchange fibers between each sides. This is cut section of the vermis of the cerebellum, the part of the cerebellum that connects the two cerebellar hemispheres, and this is the cerebellar hemisphere showing evidently. This sulcus is called the parieto-occipital sulcus, the calcarine sulcus. Calcarine, sometimes it's called, this sulcus is called calcarine, and this is called post-calcarine sulcus, that has the lingular or lingual gyrus below it. It looks like a tongue. And this is the cuneus that belongs to the occipital lobe, and it's guarded by the parieto-occipital fissure or sulcus. This is the parieto-occipital fissure or sulcus we were talking about. And if this area is called the cuneus, so the area in front of the parieto-occipital sulcus is called the precuneus. Now, anterior and posterior to the central sulcus, this continuous lobule, it's a connection between the post-central gyrus and the pre-central gyrus. It's called the paracentral lobule, and here you will find areas representing the lower limbs. So the lower limbs are thrown on the medial side of the brain. Here you will find a cut section, longitudinal section of the brainstem. This area is the midbrain. This is the tegmentum of the midbrain. with the mammillary body that belongs to the hypothalamus in front of it, and the tectum of the midbrain, which guards together with the tegmentum the aqueduct of Sylvius, connecting the space of the third ventricle between the two thalami and the fourth ventricle. This is the fourth ventricle. This is a cut section of the pons. This is the basis pontis, and this is tegmentum pontis, and no more tectum. Tectum only belongs to the midbrain. And this is a cut section of the medulla oblongata. The part of the medulla oblongata before reaching the fourth ventricle is called the closed medulla, because the fourth ventricle is not apparent yet, and the part above it is called the open medulla, where the medulla opens to allow for a space for the fourth ventricle. So this is an idea about the medial surface of the brain. This is inferior part of the brain, and showing the inferior part of the frontal lobe. See, there is a straight gyrus here called the gyrus rectus. Besides it, in the olfactory sulcus, lies the olfactory nerve near the gyrus rectus. And these are orbital gyri and sulci. They don't belong to the orbit, of course, but they are related above the orbit, separated by the roof of the orbit, formed by the frontal bone. This is the olfactory nerve. You can see here splitting into medial and lateral stria. The medial stria will form the anterior commissure anterior to this nerve, not showing here. It's a connection between the two olfactory nerves. These two nerves are the optic nerves with the optic chiasma in between, where the nasal retina fibers cross to the other side, forming the chiasma right above the pituitary gland. Then if you go backwards, you'll find the mammillary bodies at the floor of the hypothalamus, and this is the cut section of the midbrain, showing the cerebral aqueduct of Sylvius with the substantia nigra. This is the substantia nigra and the red nucleus, and the periaqueductal gray showing in this clear cut section of the midbrain. This is the inferior part of the temporal lobe and the occipital lobe. So together you can call this lateral part the occipitotemporal gyri. The most medial gyrus is called the parahippocampal gyrus, because if you dig here, you will reach the floor of the inferior horn of the lateral ventricle with the hippocampus lying on the floor and the beginning of the fornix. So this is called the parahippocampal gyrus, with its tip called the uncus and it's part of the olfactory areas. This is the pole of the temporal lobe, and this is the intercerebral interhemispheric fissure showing here in this part, and this is a part of the splenium, or the posterior end of the corpus callosum. The fenestrations here are called the perforated substance, where it allows here and there perforated substance, where this is the anterior perforated substance, this is the posterior perforated substance, produced by branches of the circle of Willis, the striate arteries going deeper inside the brain to supply the internal structures of the brain, and it's a common site for aneurysm. Okay, this is a hint about the inferior surface of the brain. Now, to recap, I brought you a picture of the different lobes of the brain, the different gyri of the brain, summarizing what we have just said right now in the previous slides. Now, when you study the brain, you'll find the areas are numbered. Like you see here, they are called Brodmann's areas or Brodmann's numbers, and they were simply the number of the each slide with a piece of tissue of the brain on it. So slide number 4, for example, had a specimen from this area, and when was studied, it was named area 4. Area 4, function-wise, it lies on the Precentral Gyrus, so it belongs to the primary motor area. Area 312 or 123 is the primary sensory area. For example, area 5 and area 7 is the association sensory area. Here, the area 40 sensory speech center, and area 44 is the motor speech area. The superior temporal gyrus has areas 41 and 42 are the primary auditory areas, and so on. Areas 9, 10, 11 belong to the frontal lobe of the brain, and they are behavioral areas for the personality of the personality lies here in the frontal lobe. Area 17, for example, is the primary visual area. 18 and 19 are the association visual areas, and so on. So now you simply know the origin of the numbers present on the different areas of the brain. By the way, before we leave here this section, area 44 and 45 is called Broca's area. It's an area for speech, and in males it's present mainly on the left side. In females it's present on both sides. Now, I told you before how the body is represented on the primary motor area or the precentral gyrus, and the primary sensory area or the postcentral gyrus. The body is upside down, so the face and the head is lower down on the lateral side. Then comes the hand, the arm, and then the lower limbs on the medial side. Sizes of representation are not relevant to the size of the organ. In fact, the size represents the sensitivity or the amount supplied by the brain. You can see the hand here takes a very big area compared to the arm, for example. And the big areas for the tongue and lips and the eyes compared to the trunk, for example, and the lower limb. This means that these organs have a higher rate of representation than other parts of the body. That's why sensory-wise they are more sensitive. I hope you got the maximum benefit from this lecture, and thank you very much for watching.